Ireland's Health Clinic on Today. Sponsored by Boots, looking after your health.
Now, you're very welcome back to the show. Now, menopause is in the papers today with the news that more and more women are fighting to create policy around menopause wellness in the workplace. So what are the symptoms associated with the change and what are the myths? Well, pharmacist Heather Feeney joins us now to sort out some facts from fiction. Helen, great to have you with us, as always, on the show. First of all, Helen, what is the menopause?
So the menopause is the change of life. That's what it's commonly referred to as. So essentially it's when the estrogen levels drop and menstruation stops. So it's the end of a woman having a period, and it's classified as menopause when you haven't had a period for a period of a year.
Okay, we often hear nowadays about the perimenopause, which happens before the menopause. What is that?
So it's kind of the start of the levels of estrogen to decline. So basically it's kind of perimenopause through to postmenopause, with the menopause happening between.
Okay. So perimenopause can last a few years or a number of years.
A few years, yeah, that's when the estrogen levels start to decline. Okay. And then you kind of tend to see the most of symptoms coming when you're getting closer to the actual menopause, which is the stopping of the period, and then some symptoms can continue into the postmenopausal stage, so for a couple of years after.
Okay, so when your period stops, you're in menopause if you've gone through the menopause, if your period stops for a year, is that right? Yes. Or you're in menopause? Which one is it?
That's menopause. So it's actually the stopping of the period that is menopause.
Okay. So let's talk about symptoms. We often hear about hot flushes. What are the other symptoms?
So there's a couple. So there's hot flushes, which is that kind of feeling around the face and neck of chest of this kind of sudden feeling of heat that moves around and radiates. And then if that occurs quite a lot at night, then that's referred to as night sweats. Okay. And then that kind of leads into a little bit of sleep disturbance, which is very common in menopause, which again, kind of, it's a bit cyclical, which then leads into a lot of mood issues because obviously our sleep is intrinsically linked to our mood. And then further, you kind of have issues with the vagina, places like that, and also kind of urinary tract infections are far more common after the menopause occurs. So yeah,
It sounds very dismal when you think of it and you put it like that, but not everybody has all of those symptoms. I mean, some people can go through menopause, a very mild menopause.
Yeah, I think what the HSE would report is that 2 in 10 women will experience very little symptoms altogether, and then there's 8 who will describe symptoms, but only 4 of those women will then say that they're quite significant and cause them a lot of difficulty. So it's kind of along a spectrum, and you'll all experience different symptoms, so it's very specific to the woman themselves.
Okay. Now, there are some myths around the menopause. For one, if you are going through the menopause or perimenopause, you can still get pregnant.
Yeah, you can still get pregnant. So the recommendation would be that if you're over 50 and you're menopausal, then you will take contraception for a year post the actual menopause, which is the stopping of the period for a period of a year or more. And if you're under 50, 2 years of contraception following the menopause.
Okay, so you can't get pregnant is a myth. You can,
you
is the fact.
Can, yeah.
Okay. The second was you'd put on weight. We often hear that. You put on weight with the menopause.
Yeah, and you do hear that with a lot of kind of hormonal things, but actually it's kind of that stage in life where you're becoming a lot less active. So there's a lot of things to the weight piece, but it's not necessarily the menopause whatsoever.
Okay. What about the menopause and that you follow your mother? If your mother had an easy menopause, that your menopause would be similar. Is that a myth?
There's no evidence to it. So the thing around the mum is that it's a good indicator of when you'll get your menopause. So that is kind of genetically linked, but not actually the severity of it or the symptoms you're going to have.
What is the average age of a woman in Ireland to get the menopause?
So it's a bit specific. It's 52. But now that's not to say that it's going to come on 52 on the button. That's just the average. So I think it's 1 in 100 women will experience it before 40, and 1 in 10 before 40, and 1 in 100 before 30. So there's quite a bit of variance with it.
So you can go through the menopause very early, but average is around, say, mid-50s.
Yeah, that's far less common.
Okay. Now, if you want to check, if you're having some symptoms, you want to check your perimenopausal, you can have a blood test to check your hormone levels.
Yeah, absolutely.
At your doctor.
So you could pop into your doctor and you could get your estrogen levels checked. Particularly if you're quite young and you're experiencing symptoms, you're a bit concerned. Generally, if you're kind of around 50 and you're feeling the symptoms, that is the age where it does occur commonly, so it wouldn't necessarily be a blood test at that point.
We have a lot of questions, as you can expect, in on this.
Yeah.
One question here. My hair in the front seems to be thinning. I'm aged 46. My mother's hair on top almost fell out during the menopause. What can I do?
So hair thinning it's kind of caused by a complement of things. So hormonal imbalances like pregnancy, menopause, any of these things that women go through, they do affect the hair. It's also linked to your age and it's quite genetic. So as that lady has said, it's linked with her mother as well. She's had it also. But the really important thing around hair thinning is to be proactive from the get-go. So I would recommend to any patient who came into me with hair thinning to go to the doctor, get your bloods done, identify if there's some sort of indicator there that's causing the hair thinning. I'd ask my pharmacist to do a review of my medicines because sometimes it can be related to the medicines. And then there's so much things you can do around your hair further to that, like with shampoos. There's over-the-counter kind of remedies that can reinvigorate growth, caffeinated shampoos. There's a lot that can be done.
Vitamins as well, certain types of vitamins
Absolutely.
would be recommended. Mary says, I had an abdominal smear test and after 5 years of screening got the all clear. HRT was not available to me. Is it safe to take HRT? She had an abnormal smear test, she said.
Yeah, again, that's not necessarily linked. So with HRT, it's very case by case. So what doctors will do when they're prescribing something like that is they'll do it in a bit of a risk-benefit ratio. So they'll weigh up the risks of taking the medicine against the benefits.
Okay.
So with that, if someone is a smoker, if they have a familial history of cancer, if they've ever had cancer personally, they may be at a higher risk when taking HRT than someone who doesn't have any risk factors. So it's very specific.
Now, HRT is given to people who have difficult menopausal issues because there are a lot of other over-the-counter remedies you can take yourself, maybe herbal remedies, before going down the road of HRT.
Yeah. So generally kind of the hormonal therapies are more a second line. And the first line would usually be your lifestyle changes, the over-the-counter remedies. And as I said, 4 in 10 will have quite a difficult menopause, but 6 in 10 won't. So you kind of have to appeal to all spectrums. And there certainly are a lot of products available for the...
You've got some vitamins, just to point out here, this from the left-hand side here, because you want to replace estrogen. Is that what it is? And you've got plant-based. Tell us about the plant-based
Yeah, so they contain
ingredients.
these kind of plant estrogens, which are far weaker in terms of the efficacy that an estrogen would have, but they can help to relieve some mild symptoms of the menopause. They also contain things like calcium and vitamin D, because menopause can be associated with a loss of bone density. And then further, they kind of contain a special balance of vitamins like magnesium for your energy levels, different things like vitamin B to, again, maintain energy and also to maintain like your skin and things like that. So
beside that there, we're looking at 2 products, the vitamins, but there's also a cooling mist. Because, is that to help the hot flushes?
That's what the hot flushes, yeah. And I think it's something that it's kind of topical right now with the workplace comments that are coming through the news.
Of course, yeah.
Like if you need an inhaler in work for, an asthma attack or something like that, you would use an inhaler, whereas a woman wouldn't be so quick to reach for a cooling mist if she was having a hot flush. So that's actually a really good product. It's full of chamomile and things like that to kind of soothe. It also stays cool the whole time, so great for relief. And then it can be put on over makeup and things like that
When
too.
you have a hot flush, does it last long or does it vary from woman to woman?
Generally just a couple of minutes.
Okay,
now,
so you
saying
can
that
get over it.
when you're in it, if you're in the middle of a meeting and you've got a bit of a sweat or anything like that, it could be really disruptive, but generally a couple of minutes.
Great. I just want to get another question in here. Annette got on. She's asking, will she be ever able to sleep a full night again? She said, I'm 50 and in the menopause, and once I fall asleep from exhaustion, I wake up with hot flushes. She has to go to the loo, and it goes on, and she just really feels that it's really affecting her.
There's probably a couple of things to that. So if she's finding that she has to get up to go to the loo, there is an association with urinary tract infections.
Okay.
So it could be possible that she does have something like cystitis or something like that. But if it is really affecting your sleep, that is quite severe, and that's linked to the mood and so many other things. So I would probably recommend she pops into the pharmacist or goes to chat to the
goes to her
doctor.
GP, because she says as well she has a little bit of anxiety, but that does, she says, kick in as a result of sleep. You also, as you said there, vaginal dryness is one of the symptoms that some women, you can have over-the-counter products for that.
Yeah, we do. So that's a vaginal moisturiser. So that's kind of inserted using an applicator every 3 days. So some symptoms of the menopause that come from the reducing levels of estrogen is that the vaginal tissue can become quite thin and irritated, which leads to discomfort and pain. So that's a product that will lubricate the vagina and then, I suppose, bring down those pain levels and allow people to live without that discomfort.
Brilliant. Okay, they're the over-the-counter products in the pharmacy, but as Helen says, they're always go to your doctor if you are having any other medical issues associated with the menopause or that you're worried about that. Thanks so much, Helen, for coming in. Medical queries, they're always consult your GP. For more information as well, you can pop onto hse.ie. Now, tomorrow we have Michael Murphy's Dream Clinic on the show, so make sure you send in your dreams to us today at rte.ie.
Ireland's Health Clinic on Today. Sponsored by Boots. Looking after your health.